Hi, you guys. Welcome back for our daily practice questions. It is day 114, and as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, a 22-year-old sexually active woman presents for STI screening. She has no symptoms but reports a new partner. You perform a urine gnat test, which returns positive for chlamydia and negative for gonorrhea. What is the most appropriate interpretation? Is it A, she has chlamydia and needs to co-treat? Is it B, she has chlamydia and needs antibiotic treatment? Is it C, the test is invalid and needs repeating? Or is it D, chlamydia doesn't require treatment in asymptomatic patients? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate interpretation? All right, so what do we have going on? We have a 22-year-old female who gets STI screening with a gnat test that is positive for chlamydia and negative for gonorrhea. She is asymptomatic. So what does that mean? And your best answer is B. She's positive for chlamydia, so she needs antibiotic treatment, right? She's not positive for gonorrhea, so she does not need to be co-treated. I know in the past, we used to co-treat chlamydia and gonorrhea, but now the latest guidelines tell us you treat with what has the positive, okay? Question number two, a 25-year-old male presents with dysuria and complaints of greenish appearing discharge. A urethral swab is collected for gnat. Results return positive for gonorrhea and negative for chlamydia. Based on these findings, how should the nurse practitioner treat? And I'm going to read that one more time because I was jacking that all up. So a 25-year-old male presents with dysuria and complaints of greenish appearing discharge. A urethral swab is collected for gnat. Results return positive for gonorrhea and negative for chlamydia. Based on these findings, how should the nurse practitioner treat? Is it with A, azithromycin, B, ceftriaxone, C, Bactrim, or D, doxycycline? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, based on these findings, how should the nurse practitioner treat? And I tell you, if they're looking for a treatment, you need to run it back and see if they provided you with a diagnosis. And if they have not provided you with a diagnosis, then you need to run it back a step further and look at those assessment findings so that you can come up with a diagnosis, because we got to know what it is to be able to treat it, right? So it does tell us that there's a positive for gonorrhea and the chlamydia was negative. So we are going to treat gonorrhea. Your first line therapy for gonorrhea treatment is B, ceftriaxone, okay? And then lastly, question number three, a 19-year-old female tests positive for both chlamydia and gonorrhea on a cervical swab. She has no known allergies. What is the recommended first line treatment? Is it A, doxy 100 milligrams BID for 7 days? Is it B, azithromycin 1 gram PO? Is it C, ceftriaxone 500 milligrams IM once plus doxy 100 milligrams BID for 7 days? Or is it D, metronidazole 500 milligrams BID for 7 days? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the recommended first line treatment? Again, when they're asking for a treatment, run it back and see if they provided you with a diagnosis. Here, this 19-year-old female is positive for both chlamydia and gonorrhea. So y'all, what is first line treatment for someone who is positive for both chlamydia and gonorrhea? You're going to co-treat, right? So C is your best answer. We're going to do our ceftriaxone, which works on your gonorrhea, and then we're going to go with doxycycline with the chlamydia. Now remember, when you co-treat, you can do ceftriaxone plus azithromycin or ceftriaxone plus doxycycline. Now, they both are first-line therapy options, but doxy has gotten into the top of those first line therapy list just simply because azithromycin has such a heavy reputation for resistance, is what I want to say. Think about azithromycin, Z-Pak, right? Utilized so much. So that is the reason why we started incorporating other things to make sure we're getting adequate coverage, okay? So your best answer here is C, ceftriaxone plus doxy. All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I do offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.